Hello. I'm really honored to be here to talk to you about economic empowerment as it relates to women's sexual and reproductive health. I think over the decades, we've often talked about empowerment, and often it's related to women's social empowerment. And I think more recently, we've really recognized that economic empowerment is also a very important component of this. And we've seen well-documented benefits on reductions in terms of HIV risk. And more recently and increasingly, we're seeing some impact also on women's reproductive health as well. And so it's just briefly, a couple of the more common interventions in terms of economic promotion among women and girls have included cash or microfinance and enterprise, which are mostly supporting women to start or run their own business, and also cash transfers, which are essentially cash incentives that they may or may not be conditional on some sort of behavior like school enrollment among girls. And so I wanted to give you a couple of quick examples of some of the research and programs that we're working on here at GEH. One of the studies that we have is it's looking among adolescent girls in National City. It's a place where there's we've seen today with some of the data and also on Wednesday, high rates of teen pregnancy. And so this is an NICHG funded study. Susan Newcomer is our project officer as well. She was presenting yesterday too. But this is looking at STI risk and teen pregnancy. And so some of the things that we've seen most commonly in the literature, and also programmatic work as well, is focus on social factors, those social and cultural factors, especially in this population in relation to teen pregnancy. And then a lot of our own work has also included looking at violence in both risk for STI as well as teen pregnancy. But one of the things, and not surprisingly, that we're finding in some of our preliminary studies in this for this project is the role of economic factors as well. And so some of our next steps, of course, to better identify some of the factors that are so important, but also to think about the future in terms of developing economic promotion programs for teen girls. So we've done this for STI, HIV risk among adolescent girls in other countries, in other global contexts, very successfully. But to my knowledge, we haven't really done this very much in terms of STI risk or teen pregnancy here in the US. And so I think it would be really interesting to come up with programs that could be incorporated into existing social teen pregnancy prevention programs. And just briefly, a couple of the other programs that we have available, that we have ongoing at GEH. We've developed a couple of programs among female sex workers. So we've seen in the literature that microfinance is highly successful in terms of reducing HIV, STI risk among a lot of populations of women who are at greatest risk for HIV across multiple global contexts. But this hasn't included populations of female sex workers. Although this is changing, we are starting to focus more on this population. But female sex workers in many global contexts are among the groups at highest risk for HIV. And what we know about this HIV risk among this population is, economic factors are driving women to initiate sex trade in the first place. And a lot of our recent work has shown that debt and other kinds of economic vulnerability is also associated with decreased condom use and increased reports of violence among female sex workers. And we think that this is because of economic vulnerability is providing or creating this kind of urgency in women's work. And so we have a couple of programs, one in India called SAGE, where we train women to become food vendors, and then another one here in Tijuana, where we're using microfinance with VIA Microfinance in Tijuana, and also Women's Empowerment International here in San Diego. And both of these programs also have a social component as well to address gender equity, for example, experiences of gender-based violence. And so some final remarks here. I think that economic autonomy, so like access to cash, can affect reproductive health directly. So, if you have access to cash, you could be more likely to be able to buy condoms or to purchase family planning or to use that for, transportation to go and get these services to obtain family planning methods. And then, as we talked about, and with teens, economic mobility might have a great impact in terms of teen pregnancy. And then finally, women's economic independence could not only address women's, sexual and, their power in negotiating condom use or sexual negotiations with male partners, but also just in decreasing women's financial reliance on male partners altogether. And so I wanted to end on just really thinking about economic interventions having a direct influence on women's sexual and reproductive health and decision making. And I think that we're seeing the impact even in contexts where there's, social and gendered constraints are so heavy among women, and it's really limiting women's ability to make decisions related to sexual and reproductive health. And I think that economic interventions could be really useful, especially in contexts where social norms might be slow to change. Thank you.